So let's talk about making improvised splints and slings. And this will be a situation where you don't have one of those prefabricated splints such as a SAM splint. And we're going to go through making improvised slings for upper extremity injuries, improvised cervical collars, and then lower extremity splints. When we talk about upper extremity slings, this will be something that can be beneficial for your wrist injuries, forearm injuries, elbow, humerus, essentially the entire upper extremity. Now, if you have a displaced fracture, this isn't going to help much to immobilize it completely, but what it will do is will keep you from moving it around a lot. And it's particularly helpful for situations where you have a splint of some sort, but you're looking to take the weight off of your arm. So this is specifically improvised slings. And there's a couple different methods that you can use. I'm going to talk about 3 different methods here. The first is going to be using a triangle bandage. This is just a piece of cloth. It's very cheap, it's reusable, but also disposable. So if it gets dirty or lost, you don't mind a whole lot about it. You can also use things like bandanas or even pieces of clothing. The second will just be a simple jacket fold that we'll demonstrate, and then the third will be a safety pin technique. So to make the triangle bandage approach to an upper extremity sling, you will need a triangle bandage or a bandana that you've folded in half. And a triangle bandana, as I mentioned, is a pretty cheap and lightweight piece of equipment, and it's a very sheer piece of cloth, quite durable, but it is in the shape of a triangle, hence the name. So when you're using this to make an upper extremity sling, at the 90-degree angle on the triangle, you'll tie what's sometimes called a pigtail knot. It's essentially just an overhand knot or a stopper knot. And that's going to create a sort of pocket. As you can see, my fist is kind of just sitting right in there. That's going to create a pocket that the elbow is going to sit in. And so you could do this on yourself, you could do it on another person, but part of the triangle bandage will come across the chest. That's where the patient's elbow and arm would be at a horizontal line to the ground and to the body. You fold up that part and you see that knot right at the end there is now cradling my elbow. And then you'll bring this part over the back of the neck, and then you would tie these 2 parts together. You can do this on yourself, as I'll demonstrate here. You do want it to be quite high so that it does relieve all of the weight from the forearm. That's the whole point of this sling. It is also a good idea to put some extra padding at the back of the neck, because after a long period of time, this can cause a little bit of discomfort. So some socks, or make sure that it's on the outside of their jacket or their clothing right there. And as you can see, the arm is well supported. You have the stopper knot or the pigtail knot all the way at the end here. And that's how you would make a sling using a triangle bandage. Now I've put on this jacket to simulate the jacket approach, or the folded jacket approach to an upper extremity sling. And you need a jacket that is going to actually have, as you can see here, it's going to have a tie at the bottom that will make it tight. So I can cinch this down around my waist in other situations, but for this situation, you're going to use it to cinch it around your chest. And I'll show you in a moment. So you will need the jacket to be zipped. And essentially what you'll do is you'll start to fold up the jacket. The patient's arm will then go inside that little fold that you've made, and you'll hinge that up and cinch that up as high as you can. And then I'm going to come in here. You will then tighten the entire system by just cinching down the cord here. This will provide a fair amount of relief from the individual. Now, if it's a smaller jacket such as this, it might not give them much room if they also have a splint on, but in the case of just relieving some strain from the overall weight of the arm, it's better than nothing. The approach to an improvised upper extremity sling that takes the least amount of equipment is actually the one involving the safety pin method. And this one is very similar to the folded jacket approach where you're folding up the material, letting the arm sit in there and then cinching it down. But instead of cinching it down with the cord at the bottom of a jacket, you're going to place the safety pin through both sections of clothing in order to keep it high up. This one I would not recommend doing with something like a Gore-Tex jacket because you'll obviously put holes in your jacket, but for a cotton shirt, it's very effective. So what the safety method pin might look like is something like this. You would fold up or roll up the patient's clothing or shirt, have them simply put their arm in it, and then, it's going to be impossible for me to do it on my own, you would take the safety pin and you would put it not only through the bottom of the clothing that you folded up, but also through the clothing that is still close to their skin. And then once it's there, it'll keep that clothing high up so that the arm can rest comfortably. So in order to actually fold the fleece into a cervical collar, or improvised cervical collar, the steps are quite simple. I'm going to be to the side so that I don't get in the way here, but you'll take the actual collar, the neck hole, and you'll fold that down just until it comes flush with the shoulder line. The bottom portion here, you'll sort of split into thirds. You'll come up to about the armpits, and then you'll fold up one more time. And you see that that creates a nice, rather thick line of padding. So now that we have our folded fleece, we're going to apply it to our patient, which in this case is me. And so the way that it needs to be applied is with the arms actually need to be out. They can't be tucked in, they need to be lying out, and they need to be on the outside of the entire system. So you'll apply this to the front of the neck, and you simply just wrap the whole thing around, like thus. Now you'll have the two arms on each side. You'll take one arm, cross it over the front of the neck, and when you get to around the ear or the mandibular angle, you'll tuck it in. Same thing with the other side. You'll cross it in front. When you get around the mandibular angle, you will tuck it in. And this provides a very sturdy device that limits my range of motion. It also prevents me from having any jostling of the neck if I'm being evacuated. You're going to have micro movements. There's no way to avoid that, even in the rigid cervical collars. But this is a great improvisational tool in the field. In order to create a lower extremity improvised splint, there are some tools that you likely have or some equipment that you likely have in your gear that can be extremely useful. One is going to be your standard trekking poles. These are great because they are telescoping, you can adjust the length, and they are very rigid. When using anything rigid such as this, it's going to be really important that you're padding portions of the lower extremity. So if you're immobilizing a knee or an ankle with these, you're going to want to make sure that you have a fair amount of padding where these will contact the joints. If there's a lot of pressure contact, it can cause pain and even pressure necrosis. So be sure to pad areas that come in contact with your rigid splint. So in addition to your trekking poles, you could use something as common as a sleeping pad. Now this is a closed cell foam sleeping pad. These are a little less common now than the inflatable sleeping pads that a lot of people have and use, but the idea is the same. If you don't have a closed cell foam sleeping pad, you can actually use a inflatable sleeping pad. One of those Thermarest is probably the most common brand, and you'll just partially inflate it in order to give it rigidity. So we're going to go through the trekking pole splint and the sleeping pad splint approach. The sleeping pad that we're going to be demonstrating with is a closed cell foam sleeping pad. Pretty common because they're very inexpensive. More people are using the inflatable sleeping pads such as a Thermarest. If you're going to be using that for your improvised splint, it's ideal, or actually you need to inflate it a small amount to just give it some loft, and then apply it to your extremity, and then actually inflate it more, because that inflation will actually give it the rigidity that you need, the structure. So if we were doing, let's say I have a knee injury of some sort, and we were going to use our closed cell foam,
you would lie it somewhere about the middle, and then you would just fold up or roll up. If you had a roll up sleeping pad as opposed to a fold up, you would roll it up, and I got nice structure there, okay? And because this is soft, I'm not gonna need much padding around the joints, if any. It's actually quite comfortable. And you tie, a bow is actually quite simple. You could tie a square knot. Remember, if you don't know a knot, just tie a lot. So I'm gonna cinch that down above and below. Depending on how long your system is, you might need a couple different areas of contact. So I'm just tying 2 overhand knots. Square knot would be easy as well. And actually what's interesting is right now the only place I have any discomfort is where this knot is digging into my leg. So that's a situation where you could take something soft like just a pair of hiking socks and shove it underneath that area. And now that's padding. So in contrast to the sleeping mat that was quite comfortable when applied, rigid splints are going to be very uncomfortable. When I say rigid, I mean something hard and inflexible, such as trekking poles. So I'm going to take our trekking poles here and have them surround the knee that we're saying is injured. And already you can see it's a little problematic. They're going to need to be held in place, but they're also going to be causing a lot of pressure on different places. So for me right now, I can already feel it pushing on my medial knee. So I'm going to take again our hiking sock, and I'm going to take a couple of these. And then I might find a little bit of additional pressure down where the handles are going to be touching near my ankle. But once I've got my padding in place, then I'm just gonna once again secure it with the triangle bandages. And that's an example of using trekking poles, or you could use long sticks of some sort, tent poles. Anything that's gonna support this is gonna help. And again, I'm already feeling a lot of pressure under this knot. So thankfully I've got plenty of hiking socks, and I'm going to just give myself a little bit of extra padding there.